now we are here at Dermacure Clinic to demonstrate your microneedling treatment. In our case, we're going to use the micro pen. So usually we have two devices for the microneedling. We can either do the derma roller or the micro pen or derma pen, as some people call it. Here we're going to demonstrate you the pen, which we're going to be using tip with 9 needles. The tip is disposable, so I haven't opened it yet, but we're going to put it here, just insert it here, and we're going to go all over the skin to penetrate the skin and creating micro channels. This is some kind of trauma to the skin, and the skin process of healing will start immediately. Once the process of healing has started, we're going to have more collagen and elastin fibers produced into the dermis of the skin, and like that will give us more firmness and also youthful looking skin. Also the skin, because of the trauma, the surface of the skin will peel. We'll have some slight peeling, which would maybe not noticed by the client, but we'll have that peeling, which will also give us even skin tone. So now the first step of our treatment, obviously I have cleaned the skin, make sure I prepare the client, I have put disposable hat, have wrapped the client with a tissue. So the only skin I see is the face. And then I have to apply the numbing cream. In our case we're using Emla cream, which will numb the skin in the next half an hour, 25 minutes to half an hour, so the client won't feel any penetration of the needle. Yeah, that's quite important, so client feels comfortable. Usually, just after the treatment, the client starts feeling a little bit of tingling and burning sensation, because obviously we have caused some kind of trauma to the skin, but that will go away within half an hour after the client leaves the clinic. We usually apply that with spatula. The client should keep her eyes closed, so I need to be careful with her eyes. Yeah. Not very thick application, but enough. Yeah, just like that. Okay, so after the application, we will be also wrapping the client's face with cream film. That will help the cream to work faster and also to stay longer. Now we have already wrapped the client's skin with the numbing cream, and we have to wait for about half an hour or 20 minutes to half an hour to be able to numb the skin completely, and client won't be able to feel anything during the procedure, or maybe just a little bit of feeling, which is totally comfortable for her. What is the treatment good for? It's very good for large pores, any scars, fine lines, wrinkles. It's one of the best collagen stimulating treatments, which will naturally stimulate the collagen and elastin production within the dermis of the skin. We have fibrous cells, which are cells responsible for collagen and elastin production. We find them in the dermis of the skin, and those cells, with the age, as we age, they are getting lazier, and then they don't produce as much as when we are young. Therefore, we have to stimulate them constantly. We cause some kind of trauma to the cells, but this is a controlled trauma. Causing that trauma to the cells, they have the message that they have to regenerate. They have to speed up the cell turnover, and like that, giving us youthful looking skin, slowing down the aging process, improving the elasticity of the skin, definitely evening the skin tone, and overall amazing. Okay, so now already half an hour the client stayed with the cream and the skin is numb. Yeah, so now we have to remove the cream, and then we will start, we'll have to wipe the skin thoroughly before we start with the treatment. So I'm just going to put my gloves first. And as you can see, everything is sterile. I have already wrapped my device, which is here, and you can see that it's fully wrapped with cling film. Make sure that nothing from the skin will go on the actual device, because we cannot autoclave it and it has to be completely sterile for the next client. So I'm gonna remove this. Now quite important part here is that we're gonna have to use the medical alcohol skin cleansing swabs. They're completely sterile and they will prepare our skin before the treatment. Just yeah, and now we're gonna have to put the tip, yeah, and you can see that the tip has very small cut. So that cap will remove it. Yeah, I've opened it. Yeah, so I will just put it here now, and I will scroll it. Yeah, and I'll take this out. Yeah, and then I'm gonna choose the speed and also the. So this important part now, I'm going to be using hyaluronic gel all over the skin, and I will be doing the treatment with the gel on top of the skin. The gel I have put here, yeah, because I don't want to touch the bottles with my hands. It's very important, have to keep, everything has to be sterile. I'm just going to put that gel here and I'm going to be using through the treatment. Okay, so I'm going to apply the gel. Jerry, are you okay? We have already done the treatment, and I'm gonna have to wipe the blood and the hyaluronic gel. So I'm gonna wipe everything off and I'll apply another hyaluronic gel on top of the skin, and also SPF and calming cream. Okay. So we've wiped the skin, and you can see that the skin is slightly pinkish, which is totally normal, but no sign of blood or anything else. So I'm going to do another application of hyaluronic acid gel, which will help to hydrate the skin. We will add the SPF in combination with calming cream. Client starts feeling a little bit sore or stinging, which is totally normal, and it will last for about an hour, but the redness will slowly start disappearing. That cream also helps a lot with the healing process, so that will be another good thing. Yeah, so the cream will kind of disappear within the next 5 minutes. Okay, thank you.